Welcome back to part 2 of 2 immune disorders. Let's see what's up. We're going to begin part 2 by talking about transplant rejection. Transplantation involves removing cells, tissues, or organs from one individual, the donor, and placing them into another person, the recipient. Transplantation procedures have a high rate of success. However, rejection of the graft is the critical issue. Factors that affect the success of a transplanted organ or tissue reside in whether or not the human leukocyte antigens, or HLAs, perceive it as foreign. This can be impacted significantly by the type of graft used. Here are 3 types of grafts used in transplants. An autologous graft comes from one's own body. A syngeneic comes from an identical twin, or allogeneic comes from a donor who may or may not be related but share the same HLA types. And transplanted tissue is often perceived as foreign and does attack if immunosuppressant drugs are not given. So individuals who receive a transplant typically are on a significant amount of immunosuppressant drugs, especially right after the transplantation. So tissue rejection, when it does occur, can be hyperacute, acute, or chronic. Of course, hyperacute occurs immediately, and it's due to recipient antibodies to the graft antigens. Acute rejection occurs within a few weeks, and this is when the graft tissue or blood cells are damaged by the alloreactive T cells or antibodies. And a chronic rejection occurs over a prolonged period of time, secondary to the T cell generating cytokines that damage blood vessels, causing ischemic damage to the graft. Now let's move on to autoimmune disorders, which I've already mentioned a little bit, probably 2 or 3 times. But let's talk about it in general now. Autoimmune disorders are a group of disorders that are caused by a breakdown in the ability of the immune system to differentiate between self and non-self antigens. Remember what antigens are. This is a type 3 immune complex mediated disorder that is responsible for both rheumatoid arthritis and systemic lupus erythematosus, and other drugs, as we'll see in just a moment, but those are the most common. Any cell in the body or any tissue can be affected during an autoimmune response. Immunotolerance, also called self-tolerance, is usually maintained by both the elimination of autoreactive T and B cells, as well as suppression or inactivation of immune responses that would be destructive to host tissues. So a defect in any of these systems could predispose the person to the development of an autoimmune disorder. Let's take a look at these autoimmune diseases. This is just a sample by body system of the various types of autoimmune disorders that can occur. If we look under bones, we will see rheumatoid arthritis. If we look under blood, we will see lupus, and they abbreviated it with just lupus, but also leukemia. And under bones, there's also ankylosing spondylitis. Let's see if we can find some more disorders that you might be familiar with. In the brain, an autoimmune disorder causes multiple sclerosis, which we will talk about, I think shortly, maybe this week. Autism, Guillain-Barré syndrome. In the muscles, muscular dystrophy. In the skin, eczema and psoriasis. In the lungs, asthma. In the nerves, peripheral neuropathy and diabetic neuropathy. In the GI tract, celiac disease and Crohn's disease, as well as ulcerative colitis. And up in the thyroid, Hashimoto's disease, or thyroiditis, or Graves' disease. So we will also talk later on in the course quite a bit later, in one of the last 2 weeks, about metabolic disorders. And we will talk about how a lot of the disorders in relation to the thyroid are actually autoimmune diseases. So let's test your knowledge here. Which of the following is an autoimmune disorder? Rheumatoid arthritis, allergic rhinitis, contact dermatitis, or influenza? That's really easy, isn't it? I know. You all said rheumatoid arthritis. Hey, I'm proud of you. That's good. We're making progress here. Now, a patient with a systemic autoimmune disorder would experience cellular damage in what manner? A, localized according to tissue type, or B, generalized inflammation throughout the body. Well, there's a key word in the stem there, systemic, and that means throughout the body. So B must be the right answer. But it is true that in autoimmune disorder, you have these antigen-antibody complexes, and they're in the blood, and they get deposited in tissue anywhere in the body because your blood goes all over your body. So it can cause generalized inflammation anywhere in the body or throughout the body. Now let's talk about immunodeficiency disorders, primary and acquired. First, let's define immunodeficiency. I think it again says what it is just by the word itself, but it's an absence or inadequate. Doesn't have to be absent. It's absence or inadequate performance of the immune system. It is a complete or partial loss of the normal immune response. An immunodeficiency increases a person's risk for infections and cancer. And you'll find out when you have your module that addresses cancer why cancer seems to be cropping up a lot when we're talking about the immune system. Because lots of cancers, they're opportunistic. If a person has an illness or they're under stress or a variety of other things, cancer hops in and takes advantage of that opportunity. All right, so primary immunodeficiency is the basic developmental failure resulting from either a genetic or congenital disorder. A lot of kids are born missing some part of their immune system. So early detection is critical for treatment and decreasing the risk for fatal diseases. Because these young kids, and I have a friend of my son's who had a young boy, and he was sick all the time. And first it was one thing, then it was another, and he was in the hospital at least 2 or 3 times a year because he would get these really unusual disorders. They finally found the immunoglobulin that was missing. So he gets an injection or an infusion of that immunoglobulin, and since he's not been sick at all. So we just had to find out what was causing. And you have to differentiate, is this normal number of times that a kid gets sick because their immune system is new and not used to much exposure to antigens, or is this too much sickness? Is this child getting sick too many times? Vaccines that contain live attenuated viruses may be contraindicated because, again, they can actually give the child the disease because of the suppressed state of the child. And diagnosis, just as I said a moment ago, may occur because a child has a history of recurrent and or unusual infections. We'll see a list of examples on the next page, but let's move on a little bit here. So secondary or acquired immunodeficiency is the loss of immune function because of specific causes like infection or splenectomy, malnutrition, hepatic disease, drug therapy, or stress. And one disease that I'm sure we're all well aware of that is caused by an infection and is characterized by profound immunosuppression is the human immunodeficiency virus, or HIV. And immunodeficient states predispose patients to opportunistic infections, which are infections that are caused by pathogens that don't usually cause disease in healthy individuals. But if the immune system is compromised, these infections take that opportunity. That's why they're called opportunistic infections. And right now for HIV, no vaccine exists. We've been working on it for 30 years. I keep hearing we're getting close, but at this time we do not have a vaccine for HIV. So let's look at the primary immunodeficiency, and there are 10 warning signs in children that their illnesses may be caused due to a primary immunodeficiency disease. Greater than or equal to 4 ear infections in a year, greater than or equal to 2 severe sinus infections in 1 year, greater than or equal to 2 months treatment of antibiotics with little effect, greater than or equal to 2 episodes of pneumonia per year, insufficient weight gain or growth delay, and this young boy of my son's friend definitely had both of those, very insufficient weight gain and growth delay, recurrent deep skin or organ abscesses, such like in the liver or the lungs, persistent thrush in the mouth or fungal infections on the skin, and the need for intravenous antibiotics instead of just pills or liquid to clear the infections, and greater than or equal to 2 deep-seated infections, such as septicemia or meningitis. And, of course, a family history of a primary immunodeficiency. So my son's friend's child who has the immunodeficiency disorder will need to watch for it in his children because it can be passed on. So let's move on to acquired immunodeficiency. And we're going to use HIV as the prototypical immunodeficiency that's acquired. HIV is a national and global epidemic. In 2011, approximately 34 million people worldwide were living with HIV. 1.7 million people died that year, and 2.5 million people were newly infected. HIV is transmitted through blood or body fluids that carry the HIV virus. And it's transmitted, as we all know, through sexual contact, exchange of body fluids, as well as contaminated blood. Also, sharing of needles by drug users and infected mothers who give birth to their newborns may transfer the disease to the child, although we're finding ways to avoid that with some of our new drugs. And the primary mode of transmission is still unprotected sex between men. Blood products in the U.S. are being heavily screened. Needle sticks by healthcare providers is uncommon due to preventive techniques. And those who do become infected, only 0.3% of needle sticks and 0.09% after mucous membrane exposure actually contract the disease. HIV can be monitored using HIV-specific criteria, including CD4 plus T-cell counts and percentages, viral load, and AIDS-defining conditions. Let's keep our eye on this graphic here as I talk about the different levels of CD4 plus T-cell counts and viral load in relation to the 3 different stages of disease, which is indicated here with the acute clinical syndrome, latency, and overt AIDS. So you keep an eye on that, with the viral load being the blue line and the CD4 T lymphocyte count being the red line. CD4 plus T cell counts and percentages are indicators of which phase of HIV a person is in. In stage 1, the CD4 plus T cell counts and percentages should be greater than 500 cells per milliliter and 29% respectively. In stage 2, the CD4 plus T cell counts and percentages will be between 200 and 490 cells per microliter, and 14 to 28% respectively. And in stage 3, at which time HIV will have converted to AIDS, the CD4 plus T cell counts and percentages will be less than 200 cells per microliter and less than 14% respectively. Now, viral load is the term used to indicate how much virus is in the body. That makes sense, doesn't it? Viral loads can be so low that they are undetectable. And that's what you want. You want a low viral load in the body of someone who has HIV. Low viral loads are amounts between 100 and 10,000 copies per milliliter. And high viral loads are amounts greater than 1 million copies per milliliter. So do you see the inverse relationship between the CD4 plus T cell counts and the viral load? As the red line declines, indicating that fewer and fewer CD4 lymphocytes are circulating in the body, the blue line indicates that the viral load is increasing. The third thing that we talked about just a minute ago that was an AIDS-defining condition are diseases that people with a healthy immune system rarely get. The first AIDS-defining condition was the pneumonia, pneumocystis jirovecii, formerly known as pneumocystis carinii, and the malignancy, Kaposi's sarcoma. We'll learn more about these illnesses later in the study guide. Let's move on. Let's test your knowledge at this time. The nurses are reviewing the lab values for a patient who is HIV positive. Which of the following assumptions can be made when the CD4 plus T cell count is 186 cells per microliter? That the patient is in stage 1, 2, 3, or 4. I'll give you just a moment to think about it or to look at your notes. If you said the patient is in stage 3, you were correct. And how many stages of HIV are there? There's 3. So there is only 3 stages, not 4. There is a movie that was made in 1993, a full-length movie. It's 1 hour and 57 minutes and 45 seconds, but it is worth every second of watching. It's called And the Band Played On. I've included a link to a movie clip that's 2 minutes and 6 seconds long, so you can decide if you want to watch it, but I strongly recommend it. This is a very revealing movie that uncovered the attempts made by the United States to hide the fact that a new and deadly virus had evolved and were primarily killing gay men in increasing numbers. This delayed medical recognition and researching of treatments for this terrible disease delayed the recognition of the need to treat these individuals, and so many people died in the 1980s before we had any kind of significant treatment. So when you have the time, watch this very enlightening movie to gain a transparent understanding of the outbreak of AIDS and its treatment on a national and global scale. Well, part 2 of 2 immune disorders is now complete. I hope you enjoyed these 2 presentations. If you can, please watch that very short movie clip of And the Band Played On right now, and then consider watching the entire movie. Make some popcorn, make sure your under 12-year-old kids are in bed, and then watch a movie that's very enlightening and educational. Thank you again, and have a great day.